Hello, and thanks for joining me on this Sunday afternoon. I have a schedule conflict tomorrow that prevents me from having my usual Monday morning media briefing, but I did not want to delay sharing information that we have put together regarding those who have pre-registered for a vaccine. As part of my remarks today, I'm going to use a few PowerPoint slides to help show where we are in the pre-registration process. To begin, here is how you can pre-register online or on the website. This is stlcorona.com, or you can email us at dphcovidvaccine@stlouisco.com, or you can call us at 314-615-2660. More than 318,000 people have now pre-registered for the vaccine as of Friday. To put that in perspective, that represents about 1/3 of the county's population. But we want to make it clear that some of those who registered are not from St. Louis County, while many of our residents have registered elsewhere, including the hospital systems that are also offering vaccines. I share this with you to show the immense interest there is in getting the vaccine. Here and across the country, the interest is high, but the supply remains low. That is why we have put together this pre-registration list so that we can easily contact residents when it's time to set up their time slot. We will not contact someone from the list to set up an appointment unless we are confident that we have the vaccine in hand to supply the shot. Across the country, appointments have been made by the provider, but they did not receive the vaccine as expected, and they couldn't give the shot. And we're not going to do that. As you can see from this slide, the most pre-registrations in the 1B Tier 2 category are what we're seeing today. And this includes those 65 and older, and adults 18 to 65 with high-risk medical conditions. This weekend, we've been working to get the vaccine into the arms of first responders and other emergency service workers. We have so far received 2 shipments of vaccines from the state, and in the first batch, we administered 1,154 shots, and we are more than a quarter of a way through the 3,900 doses we received in our second shipment on Wednesday. The next slide breaks down the county by zip code to show the percentage of residents who have pre-registered with St. Louis County to receive the vaccine when it's available. The pre-registration trends are consistent with pre-existing racial and socioeconomic disparities. We must engage communities that are underrepresented to ensure that everyone has access to the vaccine, and that's our commitment. And here are a few of the things we are doing. We hired Damian Broadus as our new Director of Health Promotion. Damon, who came to us from the American Heart Association, where he served as a Regional Community Impact Director, is putting together a team of people who will help us reach our most vulnerable and the historically underserved. We have residents who have concerns about the vaccine, and some are not being reached with pre-registration information. Damon and his team will build on a network of community partners we have to ensure that we get the message out to everyone on how to get the vaccine. We are aware that not everyone has access to a computer and cannot fill out the vaccine registration by email. DPH has partnered with the County Older Residents Program to assist older individuals who do not have access to email. Those individuals are encouraged to call the health department at 314-615-2660. A member of our health department team will document the caller's name and a callback number, and that information is then shared with staff of the Older Residents Program, who are responsible for calling individuals from that list and filling out their registration form over the phone. Additionally, as appointments are made available to those individuals, staff from the Older Residents Program will reach out and schedule their appointment over the phone as well. The department has relationships with advocacy organizations for residents who are disabled or homebound, and we are relying on those relationships to provide access to the vaccine for our residents unable to leave their homes. We are looking at registration opportunities within communities and will work with our elected leaders and community organizations to determine the best way to do that. And we're working to provide several vaccine sites across the county to make access as easy as possible. We know that transportation is a challenge for many, so we'll do all we can to make the sites easy to get to. This week, I will announce the location of our first mass vaccination site, which will be in North County. We're also working with our Health Advisory Network to identify other groups that would not have easy access to vaccine distribution, such as cancer centers. And while the state of Missouri is working with CVS and Walgreens to handle vaccines for nursing homes and assisted living facilities, there are some facilities not connected to the state's vaccination efforts that we're working with them to get staff and residents vaccinated as well. Also, the health department has a contract with an interpreter service available for assistance needed in providing information about pre-registration and vaccine appointments. This is a big task, but I can't think of one more urgent or vital to our community. We're working around the clock to put in place systems that ensure everyone has access to vaccine as they become available. And I urge everyone to pre-register with the county or hospital or anywhere else in the communities providing vaccines. Multiple registrations are fine, but please do not make more than one appointment. Doing so could delay the opportunity for someone else to get a shot. This last slide has an email and phone number on it on how to pre-register. The email again is dphcovidvaccine at stlouisco.com. That's dphcovidvaccine at stlouisco.com. And those without internet access, please call 314-615-2660. Thank you, and I'd be glad to take any questions.
Dr. Page, we have a few, they may hit on your remarks already, but they're worth asking. What are your thoughts on Missouri currently being last in vaccine distribution nationwide?
Well, we need to get the vaccine out into the community, and we're working closely with the state health department to get our vaccine orders in and to get those vaccines into anyone in our community who is already registered. We have to go through that list in order based on the criteria set up by the state and the CDC, but as soon as we can get those vaccines, we'll get them into the arms of people who need them. This is frustrating for everyone. I know the supply is limited, and we'd like to get those vaccines as soon as possible.
I think you just said this, but is the county getting the vaccine from the state? Is that its sole source?
Yes, we don't have the ability to order vaccine directly from the manufacturer. The vaccine is distributed nationally through states, and then the states distribute that to local jurisdictions. And then the states, like Missouri, have also set up vaccinating locations as well.
And could you mention again when we will get the mass vaccine site in North County?
We expect to make an announcement later this week to the location of the mass vaccination center in North County. We'll begin staffing that up, and as soon as we have vaccine, we will get busy getting people vaccinated as quick as possible.
Are you getting regular shipments of vaccine? How frequently do we get that? Do you know?
The shipments of the vaccine come in about every 10 days or so. Those are ordered about 10 days in advance, and the vaccines are delivered based on the supply that's available and how we are getting those into the people who need them.
As in addition to that mass vaccination site you mentioned, where will the other locations be?
We'll be able to announce that the locations and our partnerships in the community. We'll be able to make that announcement towards the middle of this coming week. We're still working on those contracts, finalizing details. We want to make sure everything's ready to go before we make an announcement or start directing people to those locations. And again, we need to make sure that we have vaccine available for those sites so people can get a vaccine and make an appointment to do so.
Do you know at this point if any of these will be drive-up sites for the vaccine?
At this point, we don't plan on drive-through vaccinations. We'll wait until the weather gets better. We want to make sure that we have the chance to observe individuals who had a vaccine for those rare reactions. They are rare, but we want to make sure that we observe folks for 15 minutes to 30 minutes and to make sure that they're going to do well.
That's all we have for now. Thank you.
Okay, thank you very much.